Everybody, it's Kyle Lee. Sorry, it's been almost 3.5 months since I did my last video. Because I've been prepping myself to lose 15 pounds before my surgery. It was before my surgery was coming up, and I lost a total of 23 pounds before my surgery day of yesterday. Monday, I found out I lost 23 pounds. And since August, end of August, August 30th is when I firstly started my training with somebody that I knew it was helping me with my protein and keeping with my vegan diet. It helped me to lose the weight. Yes, I'm a vegan because the last 6 years is because I just can't eat meat. It just upsets me with my gallbladder. Sorry, was taken out 6 years ago. I just can't eat meat really well. It upsets my stomach. I can't eat dairy because of that. I've been firstly on it for 2 years on that diet. I like it. There's a lot of people who will hate me about that. I don't have nothing against other people eating their meat because I can't stop you what you eat on a daily basis, but don't judge me the way I choose my life either. But a lot of you just joining into my YouTube, I am a transgender, female to male. Transgender male is female to male. I'm changing my body becoming a male. And transgender female is a male, a guy in turning into a woman. There's a difference on that. A lot of people don't understand that. A lot of people say that we need help, go to psychics, whatever. I'm happy who I am today. Nothing's going to change me because who I want to be in life. If I want to become who I want to be, if it's worth it. Because right now I feel happier. I lost the weight. And I think I weigh under 100 pounds now because after my surgery yesterday. I went to the University of Utah as my consultation back in August 21st, 2017 with Dr. Arthur Wall at the University of Utah in Salt Lake City, Utah. On Medical Street. It's a really nice place. Only doctor that I can find close near where I live here in Idaho. And it's about 3.5 hour trip, about 4 hours to get there with traffic. And a few pit stops to stop because I didn't go my surgery by myself. I took my family member with me. My family member, my dad came with me. I just didn't want other family members with me because I just wanted no conference between other people and my family to come. A lot of people didn't know about my surgery until only a few that knew about it was my Aunt Katie, Karen, and my other cousin that lives nearby here, not far. A few other ones that didn't know about my surgery, they're kind of shocked that I didn't tell them who I was transgender because I just didn't feel comfortable to spread out the word who I wanted to become in my new life. I got my name legally changed, be a year in March when I legally had it filed, and legally changed in June. It took about 60 days because the day that had to be filed in the newspaper and all that 9 yards. But I feel better. I've been on my T-gel for about 11.5 months. It'll be a year on the 22nd of February this year. I got the steps I had to go through with my surgery was I had to lose up to 15 pounds or more. I passed that in a heartbeat. I had to weigh 210 pounds for surgery. No, I had to weigh 212 pounds. I weighed 226 before surgery. I had to weigh between 210 to 215. I mean 210 to 212. I had to weigh that much before surgery because of the obese I was over. I'm still obese, but now I'm down to day of surgery yesterday. Yes, I had my surgery. You can tell I have the drain tubes. I will explain that here in a minute. I weighed 203.203.5 pounds, and I was over 103 before surgery. After having my breast taken off, I weigh under 200 pounds. I think, 'cause I never got weighed after surgery because I didn't want to, because I was still groggy after the anesthetic painkillers that they gave me before they discharged me. Because my mom and dad had to drive me back to the hotel where we were staying. About that far from the hotel, same hotel we always stay at. But surgery went well. I didn't have much questions to ask. Only the anesthetic. How long am I going to stay at the hospital? How's the pain? I didn't have much dinner there. I only had like a veggie thing. I had a yogurt, pudding, and yogurt and orange juice, apple juice, and that's mostly it. All I had was the apple juice. I mean not the jello, but the applesauce was mixed with some stuff to help me to calm down with my nausea, because I asked them to do that. But my painkillers, they gave me 2 of them too. It went quick. Had a little. It took me after I took it, about a half hour, I had a little panic attack. It took me almost a while to calm down afterwards, because my heart was out of control. It's always normal for me. That happens. Surgery went great. My dad and I just got home this afternoon. We left early this morning for the hotel. I can't take a shower. I had to take a birth bath type situation. Like, I take baby wipes to do up here, my neck, my shoulders, my back, and under my armpits, and that's it. All I can do, and cover down here. Then I just bought some stuff Sunday, before I had to leave. I went down to the store and got me button-up shirts because I can't wear over tops, because I can't lift my hands as much right now. You can tell I can't lift as much. But I got button-up shirts, I got baby wipes, I got duct tape, not duct tape, but some stuff that I need for after my first solo next Monday when I take this vest off. And I'm still a little sore from the bruising, because I can feel the bruising. And I had to buy a couple of dry shampoo. It's kind of stuff that you spray. It's like hairspray, but you spray it, wash it in there, comb it out, and that's it. All you can do. And I had to do that for a whole week. I cannot take a shower. Baby wipes, and that's it. And it's not a whole lot, but I have to. Here's my draining tubes. It's just blood. It's hooked up to my vest right now. These are the gauze that see, this comes off, but I'm not taking it off because I had to measure my neck, see what kind of what they had to use. My draining tubes right here. I have to drain them at least twice a day. Then I have to write it down on a piece of paper they gave me. See, from my left side CCs, how many CCs been taken out. I haven't drained it since this morning because it was like that much, maybe 10 CCs of each thing. It's been draining off and on today. I'm ready to drain them off here a little bit and clean them out from wipes. They gave me small wipes to clean outside the top of the draining tubes and clean it out. It's not too bad. My pain level right now is out of 10 because I've been moving a lot this afternoon. But I'm not going to take it before I go to bed because I have to take my gel and everything after I take the rest of my stuff. Because I just took my nausea pills like 2 hours ago before I had to eat dinner, because after I got to the hotel last night, I puked. Right? I had to take my nausea pill. After talking to my good friend that lives here in town, talking to her for almost an hour on the FaceTime, just checking on me. But after I had my chips, I had to let her go is because I was puking. Because I feel like I was nausea. Forgot to take my nausea pill as needed. I had to take that right after I got back to the hotel, but never thought of it. My chips came out. I puked. And then I didn't eat nothing after that. After taking my nausea pill, after I got my stomach, I puked twice. I puked 2 times. My stomach got so upset where from the surgery, because I was walking too much for 45 minutes outside of the hotel. Because I need to get some fresh air. I just shouldn't have done that. But now I feel better. Um, but like I said, I'm doing better, and I feel 100% more better now. A little bit more. I still feel nauseous right now, but I have not taken my nauseous pill. I took it about 7 o'clock. Right now it's after, it's 10:30 now, but, and I can't take it until morning, to help me with my nausea. I take it as needed, same with my other medication I have to take for this recovery. It's because this vest is really tight on my stomach. It's like when I first wear my binder, it's like that tight. It hurts my chest. But I have to wear this for a whole week. Can't take it off, just the draining tubes. But I'm getting ready to go outside for a little bit, but I feel better, relaxed. But not much going on here. I feel better that I had one day post-op, 20, almost 30 hours post-op right now. So almost 48 hours, about 36 hours post-op, almost. But I got out of the study at about 1:30 is when my surgery got done. But didn't get out of the aesthetic till like 3:45, like a couple hours later. Because it takes me that long for my body. I should have got my hair cut before surgery, but I was planning on doing that. But I had to wait till after having to get a friend of mine to do my hair. We're on his schedule. If not, I can wait a while or find somebody. I get my hair done, get a new haircut. I haven't had a haircut for about 3 months now because I lost a hair dollars didn't do so well. But I just put my flag up on Sunday night before I left because I had this flag for 3 years now. But I get a new flag because it's just the lesbian or gay pride, just the LGBTQ. It's the gay pride. So I'm not sure. I'm not going to ask questions about that. I feel better. I hate recovery time because I hate recovery times. Talk to you guys later.